Namaste and welcome to the Bharatvaarta podcast. I'm Roshan Karyappa. We have Professor Shamika Ravi on the podcast today to discuss what our policy response should be in what is now the third year of the pandemic. Professor Ravi is a senior fellow at the Brookings Institute and a former member of the Economic Advisory Council to the Prime Minister of India, and is also one of the most recognized people in developmental economics today. Welcome to the podcast, ma'am. Great to have you back on Bharatvaarta.
Thank you, Roshan. Thank you for the opportunity.
And also congratulations on the new role at the ORF.
Yes, I'm very excited.
Wonderful. So, ma'am, when we last spoke in August of 2020, and I asked you for some sort of an exit timeline out of the pandemic, I think you mentioned a year and a half to 2 years. And, we're almost at the year and a half mark. What is your assessment of the current situation right now?
So, well, Roshan, in the beginning, I remember when we spoke last, it was just around, the first wave was sort of getting over. There was palpable fear. There was great degree of uncertainty. I think today we know the nature of the beast. Of course, it is still a highly uncertain and evolving virus. So the situation remains dynamic, but I think there is greater degree of clarity on what the policy response should be. I think in terms of the public health infrastructure itself, there has been great degree of bolstering, I think at all levels in a place like India, where, traditionally we have struggled with public health infrastructure. I think as far as COVID is concerned, I think district administrations, block administrations almost throughout the country now have a set protocol. People are far more aware. So it is a known beast now. It is no longer as unknown. And we are seeing this in the form of, if you look at various high frequency data, you are seeing that there is recovery, there is movement of people. You're unlikely to see major lockdowns even at state levels. So definitely it is getting more familiar and therefore more manageable.
Right. Yeah, I think as of today, there have been about 3.17 lakh new cases. And we're in the grip of this third wave, the Omicron variant. Any specific thoughts on this particular wave and the variant as such?
The thought is really, as an economist, we are reading up what the virologists are telling us, and the data emerging from most countries is that it's of course very highly transmissible. In fact, even our current numbers, I think, are not really depicting what the true extent of the infection is. Much worse than in the initial case, because contact tracing then was, it was quite strong. And we had a good sense because whenever people had symptoms, tests were being pushed. Today, if you look at the ICMR protocol, Roshan, the understanding is the 7th day, you are fine. In fact, the follow-up testing of also coming negative and then out of isolation, etc., even that has been done away with. So I think this variant we know is highly transmissible from the all likes of it, though. And I don't know if virologists will agree, but the data seems to suggest hospitalization is not as severe. And therefore, the severity of the infection itself is not as bad as it was in the first 2 waves. So clearly, I think we are moving, at least as far as the literature on evolution, evolutionary biology seems to suggest that the virus is also mutating to become less deadly, perhaps more transmissible, and that it is, but less deadly so that it survives. So it's a war between mankind and the virus, and a lot of hard work on behalf of every, the scientists, governments, people at large. It's sometimes amazing how in a country like India, we have not seen major pushback against mandates, against vaccines, against masking. So no, I think much better today than we were before.
No, I think, in India especially, I think the anecdotes precede the data. Right. So we haven't seen as many hospitalizations for sure. And people seem to have a more casual attitude. I think I wouldn't say casual, but at least, they understand the virus. As you mentioned, not as much of the testing also. In this entire period, I think one of our biggest successes has been our rate of vaccinations. Right. And, we've always been famously short of state capacity. And in fact, any forum would always bemoan that lack of state capacity. but we've crossed the 150 crore vaccine doses in roughly a year's mark, right? So what did we really get right on that front? And more importantly, what is it that we can adopt from that experience elsewhere?
Well, it was an unusual circumstance. I think as far as vaccination is concerned, number one, I think what really worked to our benefit is the fact that we already have, as on a regular basis, vaccination is a way of life, even at the highly localized level. Mostly, of course, it is children's vaccination, but we've had very large successful campaigns. And people are aware. A lot of public communication on vaccination has been traditionally well received in almost every part of the country. We've had some areas where there have been pushbacks, but even there, it is not the kind of pushback that you are seeing, for instance, like you're seeing in the US and certain other countries. So I think the familiarity with vaccination itself has worked to our benefit, as far as people's general acceptance of vaccines is concerned. The second is, of course, the capacity, the Indian pharmaceutical, the capacity of industry to produce at scale vaccines. Initially, of course, before second wave hit us, we were also exporting very large amounts because those were our early commitments, etc. Our commitments to WHO, COVAX, etc. I think all in all, it is the industrial, the capacity of the private sector to produce at scale and people's willingness to accept. And the state, of course, the state administration mustering all its capacity and making vaccination a very focused, high priority at all levels has worked to our benefit. But also, Roshan, I think it is largely on the back of successful vaccination drive that you are seeing also the kind of economic forecasts that we are seeing within and outside the country. In fact, the second wave was very devastating. The Delta wave was, exceptionally devastating. Like in every country, for us also it was very bad. But if that was happening simultaneously with the vaccination drive unfolding. So despite a Delta wave, we saw the forecasts, the economic forecast, quarter on quarter, remain considerably high. India remained one of the, the forecasts have been until now the fastest growing, economy in the world, and it is largely thanks to vaccination.
Right. There are also two other facets, right? I mean, one is the whole public-private partnership that we saw, right? And it worked like clockwork on the ground, really. And also the technology interventions, whether it was the app and so on, right? I mean, those things as well could be, measures that we could emulate in other policies in other spheres as well, right?
So I didn't address that part of your question, but you're right. I think this becomes like a prototype. I think if we have done this successfully in the current vaccination drive, clearly this technology and this network can be used for other perhaps health interventions. The fact that for decades we have agreed, and at least in the last 5 to 7 years, we have definitely seen a willingness to ramp up not just government expenditure on healthcare, but more so in the localized primary health center, actual, the point of touch between a citizen and the public health infrastructure of a country. So primary health centers, the creation of wellness centers, which were traditionally called sub-centers, all of that seems now to be possible. It doesn't seem like a distant dream, that if resources are made available, then the manpower can be mustered. Of course, now you don't want to make healthcare sound so simplistic. It's not like just administering a vaccine. Primary healthcare strengthening means that at a highly localized level, we also need the manpower. And there, I think we have definitely seen that some states have come out much better than the other. The fact that even the states which have traditionally struggled with public health were able to do this in vaccination tells us that if perhaps we make healthcare a high priority, which I think we should, this pandemic is really a wake-up call that we don't want to hold the entire economy hostage to something like this on a continued basis for such a long time. We are still a low middle income country. So to live in uncertainty and for this pandemic to wreak an economic havoc in the form of loss of jobs and generally livelihood and economic slowdown, I think having a strong healthcare sector becomes a sort of an insurance against those kind of shocks. So yes.
One of the other positive spin-offs from this has been the whole consumerization of healthcare, right? I mean, we saw, like, for example, these antigen tests, other kind of test kits and so on. And then, there were people, selling immunity kits and whatnot. And for a country as large and as complex as us, where, last mile, might not be possible by the state itself, right? And these kind of innovations are really important and necessary. How do you see that panning out going into the future?
Well, there is no substitute to having strong immunity, Roshan. That is clearly something that no doctor will dispute. And India has traditionally had very robust traditional, sort of medicine sector as well, which have coexisted along with allopathy. Unfortunately, until a few years back, our understanding and therefore the reform, the government intervention was very much limited to allopathy. So understanding of public, health policy was mostly, it had to do with regulation of allopathy. But the fact that we have a very, a comprehensive, a very large Ayurvedic sector, then of course there are other sort of variants. You have Siddha and homeopathy, etc. I don't exactly know the science of those, but I know, at least as far as Ayurveda is concerned, that we have had very successful experiments across states in how to bridge this gap. So, for instance, in Hong Kong or many parts of China, traditional Chinese medicine coexists along with allopathy and modern medicine. And I think a large part of policy has to be about making that that seamless for individuals. So everyone drinks ginger and takes lemon and honey and so on. But and these are all grandmothers. I mean, we know this from our grandparents and so on. But states also some states have been very proactive. In the beginning of the pandemic, Kerala, Tamil Nadu, etc. They started sending out kits, and these were Ayurveda kits. Now, but that is the reality of how the society is structured, and all that is wonderful. That they are not a substitute for vaccine is a separate issue, and that must be. And I think people know that already. People in India have been quite accepting of the science, right? Unlike in many of the richer parts of the world. But I think the effort has to be to continue to make a traditional medicine more scientific, right? So by scientific, I mean better documentation. Better, perhaps randomized controlled trials, using some of the gold standards for scientific methods. So making them more acceptable and also better regulated. I think a large part of the traditional medicine, that sector suffers from poor understanding, poor documentation. And I think that is where I think state must intervene. And the whole idea of Ayush is exactly that. Right. But again, the pandemic has sort of made it very clear that we need traditional medicine. Boosting immunity is highly, it's a sustainable sort of response to longer term healthcare challenges.
Right. So right now we're seeing very varying responses from different states to the current situation itself, right? So where I am right now, Bangalore, I mean, we have a weekend curfew. Hopefully not for too long, but we have a weekend curfew and then shutdowns after 10 p.m. and so on, right? Again, I mean, I think these are stopgap measures and people are being cautious. Governments are being cautious, not too paranoid, but just cautious. What do you think the response should be at this point of time? Would you advocate for such things, or do you think that the government should kind of put the onus on people to sort of take precautions and go about their business?
No, I think there is a role for government. I mean, remember, these are these infectious disease means there is huge externality. So it cannot be left to individual judgment alone. What are you going to do if your neighbor, for instance, behaves irresponsibly? You're not going to be able to enforce. So that is the whole role of the government when you have these kind of externalities. You cannot completely privatize responses, right? There is a larger coordination effort that is required in society. So government has a role. But I think the responses are best left to highly localized level. Different governments, perhaps resident welfare associations, colonies, etc., need to figure out what is best for them. But of course, the idea is to also contain and not let the infection spread too much. Towards that, the weekend lockdown, night curfews, the scientific basis for that is, of course, very limited. I mean, you wonder that, clearly the virus isn't active only at night. I agree. But if people are hanging out more in the weekends, and weekend is when they are going out and mingling, then it seems like a reasonable response to try and limit that. But Roshan, I mean, you have to also look at the impact that is having on the livelihoods. The MSME sector, whether it's retail, and particularly unorganized retail sector, is it's reeling under the pressure of repeated these kind of interventions. And now I've heard today that Delhi has imposed odd even on top of that. And it does, the economic cost of having these policies is quite severe. And I think we have still, we have not, in terms of even consumption, we have not gone back to the pre-pandemic level. So these are huge concern. I think knee-jerk reaction is not the way to go ahead. I think scientific basis would be better.
No, yeah, I mean, that's a very important point, right? Which is that we have a significant services economy, so many MSMEs, and these continuous interruptions means that, many livelihoods are affected. And at this point of time, it's a very tough bargain for them, right? I mean, what to choose.
But Roshan, I'll tell you, the credibility is also at stake right now. You see, parties which are imposing forms of restrictions in one part of the country, they are the ones going out and holding big rallies, elections in other part of the country. So you see, the credibility of a lot of these policy responses are also now, you see, over time, you're only going to dilute the credibility. People are going to start questioning it. That is the natural evolution of how people's response to these interventions. That election commission, of course, has come out and said no campaigning and so on and so forth. But the public at large is also seeing that parties which are imposing lots of restrictions in Delhi are very happily holding election rallies and meeting and without mask and so on and so forth in other parts. So I think credibility, I think, is at stake, and then you will see people basically violate these restrictions, and then it becomes coercive, and then we are talking unrest of a different kind.
Right. What do you make of the communication and the narrative from the government itself? I think any large program, I think 50% of the battle is just purely communication, right? And I think on that front, we've done a lot of things right, I feel. Whether it was the lockdowns early on, or even as late as the talk by the Prime Minister on the boosters, right, being just optional, just even those made it seem like what you have is not insufficient. You may take this at a later point of time. Again, very stark contrast to how it was communicated. Let's say in the US, right, where the Pfizer guy said that hey, I mean, you'll require a booster every year, something of that sort.
Yeah. No, I think one thing where we might have come out more pragmatic is the fact that India has traditionally, right from the beginning of the pandemic, refrained from this herd mentality response, like this herd response to the pandemic. I think we have done many things right. Of course, not everything right. We have also, at state and center level, we could have done more. But every country today is in the same position. On a hindsight, you believe that we could have done many things right, but I think not blindly, following this out better, being more pragmatic rather than just following the West. And whether it was the vaccination, the way we went about it, communication, I think, is a very important part, and I think this is where the Prime Minister, of course, leads from the front, and he's a communicator par excellence, but I think, it has to obviously go beyond him, and it has gone beyond him. Local leaders have also been very vocal. I think, every state, most states, I can't say every, but most states have had leaders who want to do the right thing, and many of them have taken their public along. Now, issues of data, in the sense, the death data, the reconciliation of the data, the general sense that India is hiding. I think, if you understand the way data infrastructure is in India, you will appreciate more that, look, it's a matter of time. Data reconciliation is already happening. Several states have already, done a fair bit of it, and you are going to see more and more of it, because that is the nature of a democracy. There is, the more scrutiny there will be, and as systems, have their time and take their time, that kind of aggregation happening, you are going to, obviously see that number rise. But I don't think there is some grand conspiracy being hatched to show numbers lesser than what they are, or it is just the way, that is unfortunately the gap in India's data architecture. But Roshan, on the other, as far as communication is concerned, I do think we could do more also. I think it's very important to be humble and realize that, look, we have more data. I mean, we're thinking, we have collected data on vaccination. So it would be nice to just tell people how many breakthrough hospitalization cases there are. And presumably there are few. Breakthrough infections are quite rampant, and that we know that Omicron is spreading rapidly even amongst the vaccinated. But the data from other countries are, it's telling us that hospitalization amongst the vaccinated is relatively much smaller than the unvaccinated. Now, this is where I think we should show our own data. We should analyze our own data, and that data exists in the government system somewhere.
Right.
And it's a part of communication. Like, we need to put in a few hours of analysis and talk about it. So communication can be even better, but clearly so far so good.
But all of this also makes the case for the electronic health records and the health stack and everything, right? Which again will, amplify whatever you're saying, basically.
Yeah.
Right.
No, definitely. But that is already underway. I mean, you are seeing that across state. The health stack is getting populated almost on an hourly basis with different components. So no, I think enough has been written on how the pandemic has also, sort of accelerated this transition towards health records and unified health records, so that data is portable and so on and so forth. And remember, these are not just data concerns; these are not technical concerns. At the end of the day, households or people, because they don't have health lockers where they save this kind of data, they're constantly having to do tests. The diagnostics are repeated first at the local level, then you go to the capital, then you go to Delhi or Bombay or wherever, and the diseconomies or the rising cost, because we have fragmented, which raises the out-of-pocket burden on Indian households. So all of this is obviously meant to improve care, but also it reduces the health burden.
So when we look at some of the economic indicators, right? I mean, whether it's exports or GST collections, and recently we had the GDP data and everything. I mean, we see that, they're positive. Obviously, the GDP, I think, was 9.2 something, but on a lower base rate. But how do you think we can sustain some kind of an economic revival, from here on?
Well, clearly, I think the focus has to go back to jobs, Roshan. I think growth is an outcome of the policy interventions that we're going to have. Growth is not something that you do. The job market, the labor market has been disrupted. And, the PLFS data, the latest rounds, when you begin to look at it, and especially if you look at the unit level, it tells you that different categories have suffered differently. So I think understanding of that becomes important to think of what is the appropriate policy response. That while casual labor, whom we have focused a great deal on, have lost jobs, if you look at the number of working hours and earnings, you have seen huge disruption amongst the self-employed as well. In fact, if you look at the PLFS data, you're seeing that overall inequality seems to have come down. But that is not something you cheer, because you understand that wars typically do that. Every time you've had big wars, inequality has come down, because this is like a huge aggregate shock. So COVID has been like a war. it has had similar impact on different quintiles of the population. And the job market has also, sort of seen very different response. So I think focus on jobs becomes very important. But again, I keep saying that the pathway of economic recovery, Roshan, lies through the healthcare sector. It is very clear if you're seeing what vaccination has done for economic recovery. So similarly, if we have a certain assurance that this much of public health infrastructure is available for COVID or at the local level, even if it is not dedicated for COVID, our public health infrastructure at the localized level has been bolstered. I think that assurance goes a long way, towards taking risks and economic sort of activities and people moving back, going back to their lives and going back to sort of normalcy. But the government's role in this, of course, is huge focus on capex, the infrastructure, and that is so. Basically, there will be, my sense is, a continuum of what we saw in the last budget. We are going to see more of that. The government has to sort of continue spending, perhaps more. But the consumption, remember, we are still below pre-pandemic level. So I think consumption support in some form has to come in. I think there must be, that recognition.
Right. And do you think India's export growth is sustainable in the coming years, or, what do we have to do on that front? Anything specific?
We'll have to, some people, when we hear talks and when we talk about Atmanirbhar Bharat, declining import is not necessarily a good thing, because a lot of our exports depend on imports of the raw materials. The most obvious example is the pharmaceutical sector. So, I think the global economy and the way things pan out vis-a-vis China, you're seeing the European Union, the Green Deal, or the new kinds of policies being hatched. All of that is going to have an impact on our exports as well. But I do think that we must, as a country, to realize our sort of true potential in the export, we have to get into more trade agreements. I think we have done the legwork, and then we have shied away from clinching the deal. So I think there must be a push towards that.
Right. As someone who looks at a lot of the gender data as well, do you think that the pandemic has had an asymmetric response, when it comes to men and women? Because I think again, purely anecdotally, I think, women have had to shoulder more responsibility, right? I mean, they're at home and caring for the sick and so on and so forth. What do you think on that front?
Well, the pandemic has definitely had a highly asymmetric response, impact on women, Roshan. That seems to be continuously sort of reinforced from different data. One is, of course, the vaccination itself, that we still have a gender gap as far as vaccination is concerned. And this is happening in almost every state, right? Barring Andhra, there are 1 or 2 states. But every other state has a significant gender gap. Now, the important thing is that it's an infectious disease. So if there are going to be unvaccinated, vulnerable women in the household, it is going to come back to you as well, because immunity, I mean, we know that the vaccines also, the antibodies, there is waning of it and so on and so forth. So I think one is on the vaccination front. Now, that is not because of policy. Of course, policy could be more proactive, and for women, maybe we need a renewed push or a strategy to get more women vaccinated. But beyond that, if you look at the fact that work from home gets very challenging for women, because while traditionally they have shouldered a lot of the household responsibilities, particularly when it comes to children, the pandemic has obviously aggravated that. Now, again, not so much Indian data, but data from the US and some parts of Europe seems to suggest that women are struggling much more with mental health issues. There are all kinds of problems which they are reporting because of the pandemic and work from home.
Right. And finally, I mean, for some crystal gazing, where do we go from here? I mean, if you were to look out into the future, maybe a year, 2 years from now, what do you see happening?
I think the pandemic is on its way out. It is becoming something we are more familiar with. We are learning. We have, in the beginning when we said we have to learn how to live with the virus, it sounded terrible and extremely cruel. But today, that is what it is. We are living with the virus, and we're trying as best as we can to do everything to optimize. But I'll tell you more from the economy perspective, Roshan. I think the next few years will see the realization of India's ambition as far as the whole, the ESG / the environment, the climate change vision that India has embarked upon or wants to do. Right? It is not just the transition from coal towards renewable and cleaner energy, but it's not just the energy transition. You're going to see emergence of a whole financial sector where I think the case will be made that if we attract right financing, India's transitioning to cleaner fuel will see the world transforming to cleaner future. So I think the next couple of years we are going to see heightened interest in every aspect of the economy on this climate change, this cleaner transition, and of course the focus will continue to remain on healthcare and everything related to healthcare, because no country till date has reduced its healthcare expenditure. So for us, it's an opportunity globally that we are in a position to fill that larger demand for manpower in the healthcare sector, for IT support in the healthcare sector globally. As the world is aging, with pandemic, it is like a double whammy. So the costs are much higher. And I think for India, it becomes a growth opportunity that we can tap into that.
Right. All right. That's a great note to end the podcast on, ma'am. Thank you again for being on Bharatvaarta. This was a fascinating conversation. Thank you.
Thank you, Roshan. Thank you for having me. Take care.
Thank you. Thank you for tuning in to this episode of the Bharatvaarta podcast. If you want to see more content like this, then don't forget to subscribe to our channel. We started Bharatvaarta to facilitate long-form discussions on politics, policy, and culture. We don't necessarily endorse anything that was said in this episode. If you wish to offer us feedback, do reach out to us on social media. We are at Bharatvaarta on Facebook, Twitter, and Instagram. You could also get in touch with us on our website, www.bharatvaarta.in. The links are in the description below. Until next time, stay safe, take care, and Jai Hind.